In the world of advanced cancer care, we're always on the hunt for the next big breakthrough, right? The next revolutionary drug. But what if one of the most important factors for success isn't new at all? What if it's something we measure in patients every single day? Let's get into it.
I mean, just think about that question for a second. What if a key to making treatments work better was already there, hiding in plain sight in your own blood? Well, some fascinating new research is pointing to a powerful and, frankly, a totally overlooked player in this fight. We're talking about sodium.
Okay, so before we dive deep, we gotta get this one term down, hyponatremia. It's just the clinical name for when sodium levels in your blood are too low, specifically anything under 135. And the key thing to know is, this isn't some rare thing. It's actually really common in cancer patients, and sometimes it's even made worse by the very treatments that are supposed to be helping.
All right, so here's our game plan. We'll start by looking at how sodium even popped up on the radar as this unlikely ally. Then we'll get into the jaw-dropping connection it has with immunotherapy. After that, we'll see if this pattern holds up for other treatments, explore a little of the science behind it, and then wrap up with what this all could mean. So let's start with one of the biggest puzzles in cancer treatment today. We have these amazing, truly groundbreaking therapies. But the big question is always, why do they create miracles for some patients but do almost nothing for others?
Well, it turns out the answer might have been hiding right under our noses the whole time. Researchers started digging through mountains of patient data, and they noticed a pattern. Not in some fancy complex genetic marker, but in one of the most routine blood tests there is, the basic electrolyte panel.
And this, right here, is where we get to the heart of the discovery. Analyzing this simple test revealed a really startling connection between a patient's sodium level and how well they responded to immunotherapy, those incredible drugs that basically take the brakes off your own immune system so it can go attack cancer cells.
So to really see what was going on, researchers split patients into groups, one with low to normal sodium and another with levels on the higher side of normal, specifically over 140. And what they found was just staggering.
Now check this out. We're looking at a complete response. That means the cancer basically becomes undetectable. In one major study, only 2% of patients with lower sodium got there. But the patients with higher sodium, almost 18%. That is a nearly 9-fold difference. It's huge. And this shows you how that translates into what really matters: time. Patients with sodium levels below 140 lived for a median of about 17 months. But those at or above 140, almost 33 months. We are talking about nearly doubling survival time. That is a massive, massive difference in advanced cancer. And to just put one big, bold number on it, another study, this one looking at melanoma, lung and kidney cancers, found that having sodium levels above that 140 mark was linked to a 57% drop in relative risk. That is an incredibly powerful stat that you just can't ignore. And here's the kicker. This isn't just some small, interesting correlation. As this quote from a major journal points out, serum sodium was a better predictor of success than something called PD-L1 expression. For years, PD-L1 has been the go-to gold standard test to figure out who's going to benefit from these drugs. And a simple salt level in the blood just beat it. So, okay, the evidence for immunotherapy is pretty overwhelming. But you might be thinking, is this just an immunotherapy thing? Well, the answer seems to be a pretty clear no, because when researchers started looking at other kinds of treatments, guess what? The same pattern showed up again. I mean, just look at this. For targeted therapies, the smart drugs that block cancer's growth pathways, patients with good sodium levels had half the risk of their cancer getting worse. And for good old-fashioned chemo and radiotherapy, patients with high sodium had more than double the survival odds. The pattern is it's consistent and it's profound. So this all leads to the big question, right? How? How on earth could something as basic as sodium have such a huge effect on these super complex cancer treatments? Well, let's look at some of the theories. So scientists are exploring a few really cool ideas. First, it seems that high salt conditions might throw a wrench in these things called MDSCs. Think of them as bodyguards for the tumor, protecting it from your immune system. Second, cancer cells are greedy little things. They gobble up sodium to fuel their growth. So keeping blood levels normal might help starve them out. And third, it might help neutralize the acidic bubble that tumors create to invade nearby healthy tissue. Okay, so we've seen the stunning data and we've touched on the science. But what does all of this actually mean for patients and doctors in the real world? Well, it's really about shifting from just looking at data to having a real conversation. And here is the fundamental shift in thinking. For years, we've known that low sodium is a bad sign. It's a prognostic marker, meaning it tells you about the likely outcome. But this new research alleviates it. It suggests sodium could be a predictive biomarker, something that could actually help predict who's most likely to respond to a treatment before you even start. That's a game changer.
So what's the takeaway here for you? It really boils down to 3 simple steps toward being an empowered patient. First, just recognize that sodium is a way bigger player than we ever thought. Second, just be aware of your levels next time you see your blood work. And third, the most important one, use this information to start a proactive, informed conversation with your oncology team. Now, I have to be extremely clear on this point. This is for informational purposes only. This is absolutely not medical advice. Your body's sodium balance is incredibly delicate and important, and you should never, ever make any changes to your diet or take supplements without talking to your oncologist first. Seriously.
And that really brings us to our final thought. This whole discovery about sodium's role is just a powerful reminder that sometimes the biggest clues are hiding in the simplest data. And it leaves us with this really compelling question. What other simple clues are we overlooking right now in the fight against cancer?